Hello, how are you? I'm Dr. Pepe Jimenez. You're on the Regenerative Podcast with Dr. Pepe Jimenez, Director of Renovo Health and Beauty in Tijuana City. Today we will discuss the benefits of hormone replacement therapy in the podcast. Important, it's very interesting to know that our body is organized by hormones. We can't live without hormones. There are hormones secreted at the level of the nervous system, where we have a gland, the pituitary. It would place the pituitary where it produces many hormones. If this gland fails us, this gland is in danger. We are in serious trouble. The other one going down to the neck is the thyroid glands. They control metabolism, mostly our functions. There are patients who suffer from low or high thyroid, called hypo or hyperthyroidism. And the manifestations are different, each one. There are also hormones. There are female hormones and male ones, in this case women, different hormones. Mostly they are progesterone and estrogens or estradiol. And in men it's mostly testosterone. It doesn't mean that neither of the sexes have a little bit of each one, but predominantly women have more progesterone and men more testosterone. So when there is a life change called perimenopause that defines all that type of symptomatology, when does the life change in women start to appear? When they start their first menstrual period, it is called menarche, more or less between 10 to 12 years of age, and when they stop menstruating comes the total disappearance, or it is called amenorrhea, when they stop fixing. Then they start to have the symptoms of menopause. Without going into details, everything that entails the change of life in women, it is very important that they occupy hormone replacement. Just like in men it is not so much the manifestation, because there is not even the culture in men to go to the doctor. Less than measuring your testosterone levels, it's the main hormone of the man, which is testosterone. What gives the voice? What gives the muscles? The musculature. Masculinity. So there are men who have more testosterone, who have more hair in other parts of the body, the voice, the shoulders, everything. Depends. The phenotype inherited from the father and grandparents. And there are reversed women, where there is an imbalance between more masculine hormones than feminine, and there is a more feminine women. Another is more masculine. Well, then, understanding the hormones in the body in each of the sexes, the end of the decrease of this female-male hormonal replacement. Male is when we have to do a calculation of the determinations in blood. How is a patient going to arrive? Well, in the case of women, it's very simple. She stopped getting ready or is about to get ready. She's been getting ready some days, other days. No. They are with personality changes, that suddenly they are sad, emotionally unstable, they do not have energy, their parts dry out, the skin. Hair starts to fall out. They can have losses of both female hormones at the level of estrogen. And also from thyroid problems, you can have several. And they could also have a problem at the level of the nervous system, where they are having other types of pathologies. They have to go with the specialists. Mainly they will go to endocrine. That's the specialist who studies hormones. But we internists can also approach these types of pathologies. As I was mentioning, since we hardly ever go to the doctor, we only go when we have no other choice, because something already hurts us, bothers us, or they say, you know what, I no longer focus well on myself. Decisions, as a business worker, I feel doubtful, indecisive in decisions, and he didn't go into such business. So there are symptoms of andropause. When they start to have low energy, their battery goes down, they no longer want to exercise, they don't want to play with the kids as much. There are many factors that lower your energy, but when it is daily that you say, I don't feel strong anymore. Well, if you go, there are men who are already 40 years old and testosterone is already very low, or cortisol is another hormone of which also, when we are under stress, a lot of cortisol levels are released in the morning and it starts to go down at night because a hormone called melatonin comes out, from where it is going to activate and release, so that it makes you sleepy, and in theory, it is telling you to go to sleep. But the problem is that we have, for example, I work at night, which I shouldn't, and it's a bad example, but I've done it working at night in intensive care. But they let me sleep, of course. Try. but it's not a quality of sleep as if I were sleeping in my bed home. So that's affecting, but returning to the lack of energy due to not sleeping well or not eating. Well, not exercising, and besides it adds the loss or decrease of male hormones. Females is when we have to look for the doctor to seek help, and we perform that hormone replacement at Renovo, which are basically identical hormones, likewise produced with the same functionality of not caring about the body without the deleterious side effects of chemicals. For example, the woman who is given female hormones, typical Premarin, they are chemical hormones that have side effects that can cause you clots or thrombosis in your legs. Cancer problems, probably in the future. Then, and where they come from, are derived from the urine of the mare. If patients knew that hormone comes from that animal, plus all the side effects, there has to be a second way to treat, which are the bioidentical hormones that are made in a laboratory, that are bioidentically identical to of the body, but without the toxic effects. And what we do, the same in men, apply testosterone or anti-aging hormone called DHEA, that when one has low cortisol, it gives you much more strength. So the option of bioidentical hormones, that, and who is a candidate really, we are all candidates once they are patients seen by a specialist. The measurement is low in level, both in women and men in hormones. And according to the level, this treatment is applied. These hormones are applied in people with cancer diseases. In the form of creams, woman as in the one, there is more in the man, but they also apply subcutaneous in the part of the skin where a small incision is made with the anesthesia. Local are put as some rice is nominated in English, where they are placed under the skin, and according to the amount, it is the miluk, the milligrams
that are seen from calculation.
They are slowly released over the next 7 months, so that the patient stays much more strong and balanced in everything. And what are the benefits of bioidentical therapy is that your skin looks much fresher, much more. Your hair doesn't fall out as much. Hormones in women don't have as much dryness in their parts. The man feels stronger, much more focused, mental decisions, and won't lose as fat, and the belly decreases if doing good exercise and maintaining a good diet. But apart from that, testosterone has a cardiovascular effect of an effect protector, then prevents acute myocardial infarctions. That is very important. Why do they think that when a woman enters the stage of menopause, the risk of a heart attack is equally equated? Because those estrogens that protected them from a heart disease no longer cover them. So that's why women over 50 to 55, fewer pauses, she has the same risk as a man to be able to have a cardiac problem. So it is very important to replace those hormones in each one. And for that, we are here at Renault. We can consult it. The measurement is done in blood, and accordingly a proposal is made when it is. It's very easy. The patient comes in and out in 30-35 minutes. These hormones are placed and followed up monthly, and labs are taken periodically to see how it goes. Well, in short, those are the benefits of hormone therapy, both men and women. Any questions you have, you can give us a call. Make a comment on our social networks, and anything you have here, we are to serve you again. Dr. Pepe Jimenez speaks on Regenerative Podcast, and we'll see each other in the next episode. See you later.